Hello, this is Dr. Drew Hall from Los Angeles. I'm a BLAIR upper cervical chiropractor. Been in practice for about 16 years. I just briefly like to tell you how I got involved with the BLAIR upper cervical procedure. And my story goes something like this. 23 years ago now, I got in a wrestling match after high school with a friend of mine after baseball practice, and he had me upside down over the pitcher's mound, lost his grip on me, dropped me flat on my head, and when I landed, I heard a big at the base of my skull, and the first thought I had was, oh no, I hope I'm not paralyzed. Well, I rolled over, wiggled my toes, realized I still had feeling, stood up. I didn't have any pain, I wasn't paralyzed. Being male, I did a lot of dumb, traumatic things growing up, so I figured that was just another one of them. Went on through the rest of the day, pretty much forgot about it. And slowly, over about a 6-month period, developed about 30 different symptoms. And because it was slow, I really never connected the dots of the head trauma that I had and the symptoms that I was developing. And so I went on for about 2 years, basically every day, telling myself that I'm gonna get better, it's gonna go away, and that absolutely didn't happen. But within 6 months, I had a headache, basically at the back of my head, like someone kicked me in the back of the head. And I had severe cognitive problems. Falling to sleep at night took 2 to 3 to 4 hours. When I did fall asleep, I never slept through the night. I woke up anywhere from 2 to 5 times a night. And then, of course, when I woke up in the morning, I basically felt like I didn't sleep. And if you do that long enough, you're going to develop all sorts of other problems. Within a year, I developed basically like someone beat me with a bat. All my muscles were sore everywhere. School, I still passed, but I felt like I lost 50 points on my IQ. I started getting ringing in my ears, numbness down my left arm. I developed low back pain, left knee pain, carpal tunnel in both wrists, TMJ, my sinuses swelled shut. And to make a long story short, I was pretty much a wreck. And I was so much of a wreck that 2 years into it, I was walking home from junior college from school, and I had the thought, if I have to live like this for 2 more years, I'll probably kill myself. Well, when you start to have those thoughts, it's a little sobering, and it's also a big red flag. You better do something about it. So next step, I talked to my parents. I told them what was going on. Of course, my mom wasn't so happy that I never said anything and asked me, how can you live like that for 2 years and say nothing? And my response was, well, it kind of slowly crept up on me. It wasn't overnight, and so I tend to be a positive person. I thought it'd eventually go away. Second long story short, family doctor, internist, neurologist, infectious disease specialist, MRI, CAT scan, blood test, chest x-ray, you name a test, I had it done. All of them came back negative. I was basically told there was nothing wrong with me, go see a psychiatrist. And so I did. When you're that sick, I was an eggshell of my former self, and I really didn't care what someone told me. I just wanted out. So I went and saw a psychologist. They told me I had depression and anxiety. And I said, well, yeah, I had suicidal thoughts. Obviously, I had some depression going on. But what's the solution? The solution was to go see a psychiatrist and swallow a bunch of medications. And I remember driving home with my mom and saying, Mom, I don't want to take that garbage. And my mom said, well, Drew, maybe it'll help you feel better. And I said, Mom, I don't want to feel better. I want to get better. I can go drink 12 beers and feel better. That doesn't mean I'm healthy. And so that kind of was a fork in the road. And I pretty much wrote off the medical profession because I went to 4 specialists, had all the tests done, and they told me I was crazy. So it was time to look outside of that healthcare system. What I should have been told was, you know, we've done everything inside of medicine. We really don't actually know what's going on. Maybe you should try a paradigm of healthcare that thinks a little different than we do. But that wasn't what I was told. I was forced on my own to look outside. And so I got a hold of a book that was titled Fibromyalgia/Chronic Fatigue Syndrome. I read through that book. There was a support group in the back of the book. I grew up in San Francisco Bay Area. We called them. They sent us to a homeopathic slash acupuncture office. And that homeopath, in the consultation, she basically, once she heard that I had a headache at the base of my skull for 2 years, she asked me about my trauma history, and she uncovered that head dropping incident. And thank God, she referred me to an upper cervical chiropractor in the San Francisco Bay Area, BLAIR upper cervical chiropractor, Dr. Tom Forrest. I was completely reluctant because I didn't have a high impression of chiropractors, but that's the irony in life. Sometimes the things that we're most against are what we need. And so I drove 30 minutes down to Dr. Forrest's office. He explained to me that the brain basically controls every cell in the body, and at the base of the skull, the C1 sits. It weighs 2 ounces. Your head weighs 10 to 12 pounds. This is the most vital area of your body, and it's structurally the weakest. And so the drop on the head made sense. He took some pictures on me, x-rays of the upper neck, to determine exactly how that atlas was out of position. That's that guy right there. So he found how that guy was out of position. In my case, my atlas was up and forward to the left. He got under my left ear. There was no twisting, there was no popping, there was no pulling. Made a very quick correction. I felt nothing. It was the first time in 2 years I slept straight through the night. And that caught my attention rather quickly. When I woke up in the morning, I felt like a human being again. Everything wasn't gone, but there was definitely a shift. And over a 6-month period, in cycles, it wasn't overnight, I did better and then worse and better and worse, and gradually all 35 of the symptoms I had disappeared. And so I always tell patients, when you go from wanting to killing yourself to feeling better than you have in 3 to 5 years, it was obvious what I was supposed to do with my life next, and that was the impetus of me becoming a BLAIR upper cervical chiropractor. And now the fun part of my practice is I get to see people with all sorts of diseases, syndromes, and symptoms respond to correcting this most vital part of the structure of the body. So 16 years in practice, we've seen 9,000 patients. Upper cervical care is not a cure-all for everything. However, no matter what you're dealing with, if your C1 right here at the base of the skull is out of position and it's impacting the central nervous system, the central nervous system is what controls everything. And your head weighs 13 pounds, it's sitting on a 2-ounce bone. If that vertebra is locked out of position and it's causing your body not to work right, regardless what you're dealing with, if you correct it, your body's going to do better. And if your body's functioning better, it's going to give us the best chance to heal and repair back to normal. So that's my story. If you or a loved one or anyone you know is dealing with a chronic health problem that hasn't responded to conventional care, I urge you to try out BLAIR upper cervical chiropractic work. They'll be glad that they did. Thanks and have a good one. I hope this video made sense and it will help someone out there who's suffering with some sort of health problem.